Hi, Glenview.
Hi, Glenview.
Hi, Glenview.
Suicide is a serious thing that affects millions of people worldwide. It's estimated that for every person that dies by suicide, there are at least 7 to 10 people who are permanently affected.
That's why it's important to start a conversation around suicide and suicide prevention, to let those who are considering it know that there is always another option.
But first, what are some signs that someone may be experiencing suicidal behavior?
If someone is talking or threatening to harm themselves, even if it is said in a joking way or a joking manner, that is a sign that they may be suicidal. Same with if they are looking for ways or talking about ways or asking about ways to kill themselves, or writing or talking about death and dying. Those could be signs they're suicidal.
But those signs seem somewhat obvious. Are there other ways to tell if a person may be considering suicide?
Absolutely, there are less obvious signs that a person may be exhibiting when it comes to suicidal thoughts or if they're contemplating suicide, such as increased or new substance abuse, taking part in reckless behavior that isn't normal for them, whether or not they're sleeping all the time or they're getting fractionally no sleep at all.
Additionally, feelings of hopelessness, helplessness, severe anxiety, agitation, and extreme anger are all indicators. Dramatic mood changes and withdrawal from family and friends are also indicators of suicidal thoughts.
If a person appears to be getting their affairs in order, like writing a will, giving away possessions, or making arrangements with family members, that could be a sign that they're also having suicidal thoughts. Same if they begin to say goodbye to people as if they won't ever see them again. If you notice that someone is exhibiting these signs, here's what you need to do.
First of all, reach out to them, let them know that they are loved and you're here for them. Tell them that you're not going to judge and be judgmental, and show them that you care. You should always trust your judgment and your instincts when it comes to approaching someone that may be suicidal or you think could be suicidal.
I know that asking somebody if they are having suicidal thoughts or are contemplating suicide can be one of the hardest things that you have to do or you might have to do, but it's the first step in suicide prevention. So when you're approaching somebody that you think is contemplating suicide or are having suicidal thoughts, it's important to remember what their perspective is like, to acknowledge their pain, to be respectful, and to make sure that you are sympathetic and empathetic to the pain that they're going through and what their feelings are in that moment.
To start the conversation, some examples of good questions you can ask are: how are you coping with things in your life? Are you ever thinking about hurting yourself? Are you thinking about suicide? Do you ever feel like giving up? However, there are some things that you should not do when asking someone about suicidal thoughts. You should never be judgmental, undermine their feelings, and never promise to keep their feelings a secret. If you feel like they're in immediate danger, it's important that you get help for them.
It's also important to help the person find the right resources, encouraging them to bring their concerns to a trusted adult, teacher, or guidance counselor. At Glenview, we have Ms. Shard and Ms. Meadis, who are our CYWs, as well as Ms. Risdale, who is our social worker. They are all amazing options as well. Also, you can encourage them to call a suicide hotline number, seek treatment, and offer your assistance and support as well.
If someone is in immediate danger or has attempted suicide, if you are with them, do not leave them alone. Call 911 and tell a trusted adult or family member immediately, please.
Lastly, if you personally are experiencing suicidal thoughts or feelings, please know that there is hope. You are not alone and you are loved more than you know. Reach out to a trusted adult, teacher, or friend and let them know how you're feeling. Remember, there's always another option.